the impact of COVID-19 in patients with cancer. Since patients with cancers have compromised immune systems and are at very high risk for catching other infections, there is a big concern that cancer patients may be at a greater risk for getting COVID-19 and the complications from it, including increased chances of death. These concerns were true in the initial data, but however, with new data, the factors that have been most consistently linked with increased risk of severe disease and death in patients in cancer kind of mirror with those in general population. So with that, I mean male sex, older age, history of smoking, obesity, hypertension, heart disease, and diabetes are associated with higher risk of complications and death, with an exception of lung cancer and hematologic malignancy, where the risk of complications from COVID and death is higher than general population. Moreover, because many of the cancer patients are immunosuppressed because of the disease itself and chemotherapy, they actually are not able to shed they're not able to actually clear the virus that rapidly as immunocompetent people, and may remain infectious for a longer period of time and shed the virus for a longer period of time. And that may lead to development of multiple variants. So we do not know exactly the impact of COVID-19 on cancer patients so far. NCI has initiated a COVID-19 study in cancer patients called NCC-APS. The study is ongoing, and a full impact probably will be seen in some incoming years. So just to let you know, I think the biggest impact of COVID-19 has produced on the screening of cancers. Screening was most affected during this time. Between March 2020 and end of April 2020, the screening for breast cancer with mammograms, colon cancers, lung cancer, prostate cancer dropped by almost 80 to 90%. In June, it started to recover, but even now, the screening is actually about 20 to 30% lower than from pre-pandemic level. And the full impact of COVID-19 pandemic, like I said, on early detection is still not fully known. So we believe that maybe the cancer mortality may increase as a potential impact of COVID-19 on cancers. And that may be related to a few factors. And first of them is reduced access to the care. And initially that was because of the lockdown and shutdown, but also because of the fear of infection and reallocation of the resources, the access of care is limited. And we have seen that in screening. COVID-19 has also led to unemployment and the financial insecurities and insurance losses. And that also has led to the limited access to healthcare. And obviously social distancing and shutdowns have also led to the limited access to the healthcare. The second factor is delayed routine care, leading to fewer preventive visits, screening, abnormal test follow-ups, as well as symptom follow-ups. So as a result of that, patients are actually presenting at the later stages of the diagnosis, and that reduces the probability of survival. There are fewer treatment options available at this time because of reallocation of the resources. And many of the treatments have needed to be modified, again, due to the risk of infection and also possibly the impact of COVID-19 on general health of the patient and their loved ones. There have been delayed treatments, such as in the beginning of pandemic, many elective surgeries were postponed. The radiations and the chemotherapies were postponed. Less intensive chemotherapies were offered to the patients, again, to prevent any chemotherapy-related complications and the complications related to COVID-19. All might lead to potentially increased cancer mortality, although we do not know the full extent of the effect of pandemic on cancer mortality yet.